So once that had happened, and all of this took 7 months, meanwhile, I'm continuing in pain. We are trying all kinds of different medications to try and deal. Okay, it's nerve pain, so we'll go to gabapentin. Well, I was on a dose that almost maxed out the gabapentin without any real success. I was on opiates, which dulled everything, including myself. So at this point, I had no option but to follow what my world-class myeloma specialist was saying, which is, okay, we're going to try and knock your load down, your myeloma load down, so that we can harvest and then do a stem cell transplant. That's likely the only thing that is going to help. So, April 2004, I started on thalidomide. After 5 months, I had knocked the load down as far as it was going to go. I had my cells harvested, 2 3-hour sessions attached to a machine. If it's somebody's new listening to this, it's a lot like dialysis, where they take the blood out and then take out your stem cells and then give you your blood back so that you don't lose a lot of volume. And they harvested 21 million stem cells, which are then cryo-frozen until they're used. And so once they use them, you go into the hospital knowing into a very special wing for stem cell transplants. Back then, it had this really modern thing in the private room that was a negative pressure room because you could not afford to get exposed to anything. And at night, they give you melphalan, a very, very powerful chemotherapy drug that wipes out your bone marrow. Thus, you have incredibly weakened red cells, incredibly weakened white cells, and if you get exposed to anything, you will get it. The next morning, you get your stem cells that were harvested, or actually some of them. I have enough for at least 3, so 2 more. Got my stem cells, and the first week you really don't know much because you're just so weak, you're just hanging out in bed. After that, you start being able to move around and do things. And the third week, they have you walking around the stem cell unit. And you then get to the point where your numbers have come up enough, your red count, your white count, that you can go home. You cannot go to any place where there are a lot of people. I find it kind of funny now with all the masking for COVID. We should have done that back then. It would have made life a lot safer for those people with getting stem cell transplants. And it took 4 months to get 90% of the way back to what I was before. And that was, a good thing.